Hi there. Welcome back to the second session for emotion regulation for DBT 4FND. We're continuing on with understanding and labeling emotions. And we will begin by talking about the model of emotions from DBT, which applies to everyone, and in all DBT courses, this is reviewed, but I'd like to think about it specifically for those of you with FND to be thinking about the fact that um, everyone's FND is different. And we know that there may be some interactions with emotions, and emotions are complex, full system responses, and changing any part of the system can change the entire response. And knowing the parts of the emotion can guide your efforts to change an emotion. And also, they guide you in knowing how to change some of your FND symptoms or make them less likely to happen. So, I want you to think about all the different areas that you can change emotions that may be linked to your FND. And how do we know that emotions are linked to FND? Just reviewing some of the data again on the fact that people with FND um, have been shown to have some deficits in their ability to label and be aware of emotions. We know that they have high arousal and difficulty regulating emotions, and understanding which components of the emotional system are affecting FND and FND is affecting can help you really understand and possibly get some control and change some of your FND symptoms, hopefully, possibly decrease any triggers. But for some people, it may be part of a biological response. And for another person, it may be that your secondary emotions may be a component of this. So just have an open mind. And again, it may not make any sense when you first hear this, how this may be related to FND, but we think over time you will be able to customize and personalize this for your own situation. And so, as you can see in the background here, we have this very complicated diagram, and don't worry, it is kind of overwhelming. When I first saw this diagram, I felt kind of overwhelmed and emotional myself. And but as you become familiar with it, you will see that this handout really shows all the components from affective neuroscience about emotional responses in the form of a flow chart. With some exceptions, the components and categories match those on the worksheets we're going to have you do, and really make some effort to review this. This is important because emotions are complex. Emotions generally consist of several parts or different reactions happening at the same time. They're automatic. Emotions are involuntary, automatic responses to internal and external events. Emotions cannot be changed directly. We can change the events that cause emotional experiences, but we cannot change emotional experiences directly. So we cannot instruct ourselves to feel a particular emotion and then feel it. We cannot use willpower to stop an emotional experience, even when we desperately want to. And we cannot instruct ourselves to actually feel something that we don't feel, which can be the case in FND, where you might be numb to emotions and not in touch with emotions, and you can't just will yourself to feel an emotion. Uh, and then emotions are sudden and they rise and fall. So emotions ordinarily occur suddenly, although the intensity of a particular emotion may build up slowly over time. They are also like waves in the sea. Because they rise and fall, most emotions only last from seconds to minutes. So emotions are self-perpetuating. Once an emotion starts, it keeps restarting itself. We might even say that the emotions love themselves. This is because emotions sensitize us to events associated with emotions. And so emotions have components. These components are interrelated, and each component influences each other. Thus, although an emotion can be thought of as complete and a transactional system response to external and internal events, it can also be very helpful to think of it in terms of examining the components separately. A very important take home message here is that changing just one component can often change the entire emotional response. And so some emotions are universal. There are probably about 10 to 12 universal emotions. They are anger, disgust, fear, guilt, joy, jealousy, envy, sadness, shame, surprise, interest, and love. And we'll go over each one of these. We'll create an apothecary of descriptions that you can use and even use as a reference. And people are born with the potential, the biological readiness for these emotions, and others are learned and are usually some combination of basic emotions. So let's look at this. This is your first time looking at this model of emotion. It could be a little bit intimidating here. And we will just look at the beginning part of it, the prompting emotion. So let me see if I can get my cursor here. And so you um, may be able to see here this prompting event here in the middle there. I want you just to think about that rectangle here, and we're going to talk about that for a minute. So, um, prompting events are events or situations that occur right before an emotion starts. They're the cues that set off the emotions at the particular moment instead of at some other moment. Prompting events are not the events that led up to the prompting event, and prompting events can be external, outside of ourselves, or the environment, or they can also be internal, inside of a person. I've seen a lot of people with FND um, uh, symptoms that start off with maybe a sensory symptom that they felt before, um, pain in a certain part of their body, let's say the knee, and that pain reminds them of something from the past, and a initial feeling of fear might occur. So sometimes an internal sensation can prompt an emotion. So it doesn't always have to be something that's happening on the outside. The prompters can also be external, like maybe you're watching somebody do something. Maybe you're at a wedding, it starts to rain, or a friend says something that you don't like and makes you feel sad. Um, and then sometimes events can just automatically, without even thinking or interpreting anything, an external event can prompt an emotion automatically. That is, a person can have an automatic reaction without any thought of the event. You may feel fear when you're looking down from a high place, or joy when seeing a beautiful sunset. Um, and so when prompting events change, emotions can change. So you can change emotions by changing the prompting event. You can avoid these events that cause emotions you don't want, or you can take actions to change them through problem solving. You can also desensitize to prompters, and that can where you repeatedly have that prompter over and over again, and it stops prompting the emotion. So that's one area where you can have influence on this emotional response machinery. So think of it like an engine, like your emotions are like a car, and there's a lot of components to it. And the next component I'd like you to attend to, no pun intended, is attentional awareness. So that is right after the prompting event. So you do need to be aware and attending to a prompter for it to happen. If you're asleep and something's happening, it's not going to prompt you because you're not awake, attending, and aware of the prompter. And so the a prompting event will not prompt an emotion if you're not aware of it actually happening. So the event has to grab at least part of your attention to have an effect. So let's say your mother says something, criticizes something about you, but your phone has died, so you don't get to hear it. And so that doesn't actually prompt your emotion. There is no emotion without awareness. And when attention is distracted, emotions can change. So that means too, if you can change your attention, take your attention away from something, you can also change that emotion. So that's why distraction often can be such a good way of changing our emotions, especially away from prompting events and a way of modulating that we'll be talking about in further detail. Now, I'd like you to then move to this circle where there is interpretation, thoughts and beliefs about a prompting event. Now, this is a little juicy area, and um, often what really sets off an emotion is what we believe or the meaning we make of it, not the event itself. Interpretations are thoughts, beliefs, or assumptions about an event or an appraisal of an event. So let's say your best friend is walking down the mall across from you, and you wave and shout their name, but they keep walking. You might interpret this as meaning this person doesn't like you anymore, and you might feel hurt. Or you might interpret it as, oh, the mall was crowded and they didn't see you, and then you wouldn't feel hurt. The same thing can happen with bodily sensations. If you have certain meanings about a bodily sensation, if one of your sensations has led to uh, a very long, distressing event, let's say, when you feel some ringing in your ears, that might be a signal that you're about to have a seizure. And so when you hear ringing in your ears, you might get very afraid and have the interpretation, oh my goodness, I'm going to have a seizure now. And that could really increase the amount of fear that you have. Um, and that's why sometimes our beliefs and our thoughts and interpretations, especially, can affect our somatic symptoms and our emotions about those somatic symptoms. Interpretations, as well as beliefs and assumptions on which they are based, may become part of very complex emotions. For example, despair is sadness combined with a belief that things are terrible and will not get better. Many interpretations are based on learned beliefs, things that have happened that we've learned about, that have happened in the past. And when interpretations change, emotions change. So you can change emotions by checking the facts and changing your interpretations, beliefs, and assumptions. Or you can put rose-colored glasses on and decide to think differently about them as well. And so we'll return to this multiple times. Now we're going to go to pre-existing vulnerabilities on the top of this model. Now, this is also another juicy area. So vulnerability factors are conditions or event that make an individual very sensitive to a prompting event, like it's more likely to make emotional interpretations and more biologically reactive to a specific event. These can occur shortly before the prompting event, or they can occur in the distant past. So events from the near past can make us very vulnerable if we have not had enough sleep or have not eaten or been sick or recently disabled, or have used certain medications or mood altering drugs. This can be very stressful, or have just gone through something very stressful, or we are likely to be more vulnerable to emotions than at other times. In addition, sometimes a prompting event is like the straw that just broke the camel's back. It's just like an accumulation of things, and then finally, it just the dam breaks. Um, so um, be aware that events from the near past can make us vulnerable. And then events from the distant past can also make us really vulnerable. So events from distant past can make us more vulnerable to the present. This is particularly true if we've not processed or resolved the prior events, or if they replicate pervasive, invalidating experiences such as racism, um, uh, um, implicit biases against internal characteristics that we have had, and especially true with FND, where people in the medical community have perhaps misunderstood or questioned whether someone was faking their FND symptoms, so that when someone questions it could make you even more emotional, not just to this one person that's invalidating or not believing you, but it could bring up things from the past and make you much more responsive or sensitized to that emotion because of the past. So if you or your community haven't had a traumatic experience related to discrimination, it might be really hard to understand how these stick with you. If your ancestors were also had trauma or related to discrimination, you might carry much greater weight for you than those who have not. And there seems to be also some genetic predispositions or epigenetics. So people who have been in famine um, often have from several generations back can show different responses to and emotions when scarcity of food is involved. And so there are, when you think about it, trauma can make us more vulnerable to all sorts of emotions. So if you've had adverse childhood um, reactions or just chronic things that have happened in your adult life, that those can make us vulnerable. So when vulnerability factors change, emotions can change. You can reduce negative emotions by reducing your current vulnerabilities. You can do this by getting more sleep, for example, or having less stress and observing your limits, saying no to things, pacing yourself. But there is dialectic of acceptance and change when dealing with vulnerability, being aware of one's vulnerability, and then also building emotional resiliency by learning how to deal with emotions. So there are then the biological changes we want to talk about. So here you can see this big box, big rectangle here with the biological changes. So these are things that are happening kind of outside. You get a prompter, your attention is paid to it. You've got some thoughts going on, beliefs, some pre-existing maybe vulnerabilities, both in the short term and the long term, and then your brain decides to execute some biological changes based on these experiences. So the first one you might be thinking about is the emotions that involve brain changes. So the emotions really deal with neurochemical changes in the brain. So some parts of the brain, like the limbic system, appear to be very important in regulating emotions, and the brain changes can then have effects on the rest of the body. So, the research on this and the brain circuitry shows that there appears to be many emotional brain circuits. Different circuits or systems appear to be associated with different broad groups of emotions. Examples include rage and anger system. There's a fear and anxiety system, a lust and sexuality system, care and nurturance system, a panic and separation system, play and joy system. So different parts of the brain, the amygdala, hypothalamus, anterior cingulate, and different neurochemicals, serotonin, norepinephrine, oxytocin, prolactin, are associated with the firing of emotions and the regulation of emotions. So some people have different regulating, some people have more or less difficulty regulating all of their emotional circuits, while others have difficulties in only one or a few of these circuits. Um, then there's brain asymmetry. Differences in activation of the left and the right regions of the brain are related to predispositions for positive emotional states, right activation, low compared to the left activation, and negative emotional states, the left activation with low compared to the right. So, for example, some studies have shown that people with clinical depression compared to people without it have decreased left brain activity. Differences in the right brain versus left brain activation can really influence vulnerability to these emotions, and high and low activation in various parts of the brain can make it easier or harder for some individuals to regulate their emotions. Um, so, emotions, you know, um, they're also, some people have uh, problems in brain chemistry. So we believe that some people have trouble regulating emotions and that they have problems with their brain chemistry as well. So emotions involve nervous system changes. The nerves and that are peripheral to the brain and the spinal cord send signals to the muscles to contract or relax and also control autonomic activity. For example, the action of the heart and the glands and the breathing and the digestive process and the reflex. All of these responses are also part of the emotional responding. There are two nerve systems controlling the autonomic processes that act in opposite directions from each other: an activating system and a deactivating quieting system. So when we are under stress, the activating system kicks in, called the sympathetic nervous system, and it increases heart rate and blood pressure, and it cools the skin and causes sweating, increases the rate of breathing, and activates the production of sugar to give us energy. It prepares us for action now. And then the other system, called the parasympathetic nervous system, counteracts these actions by slowing down the body. And when we are relaxed, this quieting aspect of the system takes over. So when biological processes change, emotions can change. So we can change our emotions by targeting these biological processes with medications, neurofeedback, ECT, behavioral skills, evoking the parasympathetic nervous system, with traditional healing practices, yoga, breath, um, different postures. And the psychoactive drugs work to control emotions by changing brain chemistry. So, putting drugs into the system can have a powerful effect on our emotions. However, once the brain knows the drugs are there, it often changes the chemistry again to kind of compensate and then disrupts. And then sometimes the drugs quit working. This is especially true for drugs of abuse or recreational drugs. Um, and then lastly, the dysfunctional behaviors can also regulate emotions through biology. So many dysfunctional behaviors, such as using drugs, self-harm, cutting, even FND symptoms themselves may serve to regulate emotions by regulating biology. And in these cases, however, the behaviors take a great toll on us in other ways. And some of these behaviors are under voluntary control and some are not under voluntary control. And so working on those behaviors can also be a point of changing emotions. And then experiences. So emotions are almost always associated with experience of feeling sensations and the urges to do something. So that's the bottom part of this uh, rectangle here. So we'll talk about, so there's biological changes, and then you're going to feel something from these biological sensations. Although for FND, we think that there may be some problems in actually the feeling of those sensations. So it's important to start to be aware and to try to kind of turn up the volume of sensing what these biological changes are associated with emotions. It may be that people with FND are mislabeling those body sensations as not as outside of emotion. Or they just may have like a decreased volume and they're just not feeling and sensing those, or perhaps a combination of that. But this is, I think, a very important part of and why we're going into so much depth about labeling and understanding emotions so you can start to really experience them and turn up the volume of the ones that you're not feeling enough of. Um, and let's see, and we'll go into more depth about why you would actually want to do that. Um, but when we have emotions, we are actually sensing our body and brain changes. This is usually what it's meant by an emotional experience. Sensations are an important part of emotions and are the reason we often call emotions feelings. But sometimes they are very hard to sit with. Sadness involves sensations of low energy, heaviness, emptiness. Anger involves sensations of high energy and agitation. The experience of sensations cannot be changed directly. If sensations we don't like could be changed directly, we would all get rid of them very quickly, right? They are experienced just like physical pain. And so, but what would happen then? We wouldn't avoid dangerous situations if a child was lost, because we wouldn't have any emotion about it. We would not feel jealous, and then we might not protect what we have. We might decide to give up on anger and not defend ourselves in a fight. Or, if we're not afraid, we might give up and not try to survive. So, from an evolutionary point of view, these feelings and experiences of emotions are critical for survival. The experience of sensation can only be changed indirectly. For example, we can focus our attention on something else through distraction, or we can change our biology to block the sensations. So, when people tell you to quit feeling an emotion, it's like telling you to quit feeling the rain coming down on your head when it's pouring. Um, and the same thing if somebody says, why don't you feel an emotion? You can't just make yourself feel an emotion. The only way to quit feeling is to divert your attention or change some other aspect of your emotion. Or maybe you need to pay more attention to the emotion as well. There's the dialectic. Um, and although sometimes it's easy to do, sometimes it's next to impossible. And so telling a person to divert their attention when their foot is on fire, for example, would not be effective. Uh, and so I want you to think about that. And while we move on to the action urge, so this is kind of the sensing part of the emotional system. Then we're going to move to the actual expression part. This is when we start to respond to these biological changes and these sensations, and we start to act. And action urges are an important function of emotion. They prompt us to do what's necessary, usually from an evolutionary point of view. If we're feeling angry, we get ready to fight. Many of the nervous system changes described are designed to activate the body to be ready for an action. As the body gets ready for an action, very strong urges to act can arise. So then, then there's the expression. So once we're ready to and we get an urge to act, it might take just a microsecond. You might not even be aware of it, but then we express emotions. And one of the most important functions of emotions is to communicate. And to do this, one of the most important ones as well are facial expressions that communicate to others with or without our awareness. Facial expression is primary or basic emotions is really hardwired into human beings. Research shows that in all cultures, there are some facial expressions that are linked to the same basic emotions. Many actions that express emotions are hardwired. A change in facial muscles when emotions are activated is universal. People are extremely sensitive to facial expressions from early childhood, and during infancy, emotional expressions are especially important social signals at the time when verbal communication is not possible. So researchers now think that changes in the facial muscles play a very important role in actually causing emotions. We humans have more nerves in the face than anywhere else in the body, and facial expressions for many of our basic emotions are the same across cultures. And the importance of facial expression in communicating with others is likely very important to our survival. So, also, not only our faces, but the rest of our body also communicate emotions. So even when our faces cannot be seen, our bodies can communicate emotions. Our posture can be relaxed, tense, droop, or shoulders back. Our hands can be clenched and tight. Each different posture sends a message to others about how and what we're feeling. So people can learn to inhibit emotional expressions or to express them differently. For complex emotions that are learned, the expressions are also learned. Some facial expressions and behaviors may express different emotions depending on one's overall culture, one's religious culture, and one's family culture, school culture, individual differences. Um, so the words also communicate emotions, telling other people how we feel. So our language, also a particular event on how we feel, the tone of our voice, the intensity, the quality of our voice can also um, communicate to others our emotions. And it can improve others' understandings of us and elicit reactions in others that are needed. If we express fear, then somebody might come and help us. When facial and body expressions change, emotions can change. We can change emotions by changing our facial and body expressions. In particular, the connection among our bodies, faces, emotions is so tight that we can change our emotions simply by changing our facial expressions. This is called the facial feedback hypothesis. And we can also change our emotions by changing our posture and how we hold our hands and the tightness of our muscles. So, changing emotional expressions is different from suppressing emotions. So, when you suppress an emotion, you are working hard to restrain, stifle, and hold back a natural expression. It's like trying to smother the expressive part of your emotion. So, suppressing emotions can lead to more extreme emotions. Um, and sometimes it can also lead to somatic symptom expression rather than um, uh, a body posture. And we think that there might be some connection to FND in this. So, in contrast, when you change an emotional expression, you're replacing one's expression with another, and you are actively altering the muscles to modify your expression. Generally, this is very hard to do. Um, and so, emotions prepare us for action. So one of the primary functions of emotions is to prepare the body for action. And thus, An action itself can be thought of as part of the entire emotional response. So emotions in general can be thought of as a rapid response system. Um, Remember, emotions evolve in order to prompt actions necessary for survival. Later in the module, we'll really review how particular types of actions typically go with specific emotions. And when actions change, emotions can also change. So you can change emotions by acting the opposite of an emotion, and that can kind of have a backwards effect and change the emotion. So actions themselves have a big can be affected by emotions and can affect emotions. So so this also is an area where people with FND might have problems. Sometimes they may not be expressing their emotions for others to see. They might sometimes some of their FND symptoms appear to look like expressions of emotion. Not everybody, but you can um, consider that as well. So this part of the emotional system can go awry and can be affected by FND. The next part, so after this, you've got the biological changes, you're expressing the emotion. Often, this awareness, like, oh my goodness, I'm having an emotion, comes on board. And I'm talking all these things are happening, at lightning speed, in microseconds. But as this happens, you might start to be aware of an emotion and then give it a name. This doesn't always happen with everyone if they're not able to name, but naming is universal and helpful. Every culture gives names to emotions. To name an emotion, it also requires awareness of the emotion. And when we are communicating to others how we feel, it's important to be able to identify what emotions we are actually feeling so that our communication will be accurate. There is some evidence that people who can give an emotion a name experience less negative emotions and more positive emotions. And how to name emotions is often learned. Obviously, it's easier to name simple emotions than complex ones. So, through awareness and naming, emotions can change. So, you can change emotions by learning to be aware of them and to name them. Your language machinery can actually help regulate those emotions and change them. And we're going to talk a lot more about this in this module. Um, and so I, the FND component of this is that people with FND in general, that when they study groups of people, it may or may not apply to you, but groups of people with FND seem to have difficulties in naming emotions, both being aware of their emotions and naming their emotions. So another area that may be able to building out some type of uh, ability to name and be aware of emotions, we think may be able to compensate and help you with your FND symptoms. So, the next component here, the last one here, is you can see the after effects of an emotion. So, I think the intense emotions can have really powerful effects on memory, thoughts, the ability to think, physical functioning. And there's this saying that emotions love themselves. One of the most important after effects of emotion is that we become hypervigilant to cues and events that could set off the same emotions and attention uh, off the same emotions, and our attention gets narrowed to information that's incompatible um, with our emotions. So, um, in that way, emotions organize us in a way to kind of be biased. And just like, when you're looking, when you're shopping for a lamp, you go to a store and all you can see is lamps. Well, if you've got an emotion and it going on for a long time, like anger, then everything you see kind of has a flavor of anger or might support that feeling. Um, And so monitoring your after effects of an intense emotion can help us change also the subsequent emotions. So once you know that intense emotions narrow your attention and increase your sensitivity to the cues of that same emotion, you can remind yourself to check the facts, knowing that you may be seeing things through lenses of the emotion you are trying to change rather than the lenses to the present reality can be helpful at this point. So, primary and secondary emotions. This is what happens next. So, um, primary emotions are that immediate first reaction that we've been talking about all this time, our spontaneous emotional reactions to events outside of ourselves that are examples of a primary emotion. That's the one we talked about in this when we name our emotion. We've got a primary emotion right there. Then we have an after effect, and the after effect can actually cause another emotion. So, secondary emotions are usually reactions to the primary emotion. So sometimes secondary emotions follow primary emotions so quickly that we do not even notice the primary emotion. Sometimes we can um, have spent so many years suppressing our emotions that we automatically jump over, and primary emotions uh, get never get experienced. And that is, we develop a habitual secondary emotional response. And secondary emotions can make identification of our primary emotions difficult. If we cannot identify and describe the primary emotions, we can have trouble changing it or regulating it. And thus, problem solving in regard to the primary emotion is difficult. This topic will come up again and we'll work on this. And so, examples might be that often with anger, a secondary emotion might be fear. In fact, for some people, anger is um, maybe um, they're afraid if they express their anger, somebody will get mad at them and something bad will happen. Um, and then for some people, anger is secondary emotion to fear. So when they're afraid, um, they want to act, they start to feel very fearful and need to protect themselves and feel that they must get angry and protect themselves. And so if anger is not a lot loud or accepted for certain people, and another example would be in a culture in which it's suppressed or not acceptable for, if you have a certain characteristic or um, then you might have shame, and that shame can get in the way of actually feeling the emotion. And then we might instead try to regulate the secondary emotion, and then have trouble actually regulating the primary emotion. All right. So that is all for this handout. And this is the whole enchilada here. I know it's been a lot. Thank you for listening and going through this whole model. There's also lots of videos you can watch that are a little bit more entertaining and short that you could find on YouTube to go over this model. And then what goes along, so this is handout 5 from the Emotion Regulation DBT book. And you can also find from handout 6 ways to describe emotions. And these are the universal emotions. So there's different words, um, there's different prompters. They give you different prompters, examples, interpretations, what the biological changes are, the expressions for anger, and the after effects. So this is kind of an encyclopedia of your emotions and how they fit into this model, um, uh, uh, emotion by emotion. So the next one is disgust. Um, the expressions of it usually are avoiding something. And then there's envy, which is usually when, and here are the different words for it, and the prompting event is usually when somebody has something that you want. And then the expression is usually, and the actions of envy are that you might work on doing the same thing that the person that has something you want has so that you can get it too. Sometimes taking away or ruining what the other person has can also be an urge that people have, or doing something to make the other person fail or lose what they have can also happen, or doing something just to get even can sometimes go along with envy. Fear is usually expressed in either the freeze response or the fleeing response, and taking yourself out of what you're doing or avoiding. And so um, you can get familiar with the fear words and the prompters, the interpretations, the biological changes, the expressions, and the after effects for fear. There's another one for happiness. There's one for jealousy. I know a lot of people are unclear about what the difference between jealousy and envy is. And jealousy is when you feel that somebody is taking something from you. So envy is when somebody has something you want. Jealousy is when somebody is taking something you already have. So they're very similar in that you're trying to protect something, or you might act out to attempt to control someone else, or um, try to make sure you get something and they don't. Uh, and so you could review this one on that. There's love, is when we want to be near somebody or something that we enjoy, that we care about. And then there's sadness, and um, the expressions of that might be avoiding things, withdrawing, avoiding activities. Shame is when we're worried that we will be judged by others and rejected. So we might hide things or withdraw, bow our head, appease others. And then guilt is when we feel that we've harmed somebody or broken our own integrity and values, and that we need to repair. So guilt gets us to repair things, make resolutions to change, um, do self help, and improve ourselves. So, if you'd like to do the homework, you're really motivated, you can look on worksheet 4 of emotion regulation, and you can select a current or recent emotional reaction and fill out as much as you can on this model of emotions, and really start with what prompted your emotion, what set it off, what happened in the few minutes before the emotion started. Then think about what your thoughts, assumptions, beliefs were, what your vulnerabilities were, what happened before to make you vulnerable in the short term, and what made you vulnerable in the long term, what your biological changes in your face and body, what your action urges were, what your how you expressed it with your face and body, how you expressed it with words or actions, uh, what how what your awareness was, what you named the emotion and the intensity of it, what the after effects were. Did you have any other thoughts or narrowing of your attention or biases? And then if you had any secondary emotions. All right. And that's the end of session 2. Next session, we'll be talking about uh, checking the facts and changing your emotional reactions. So you've completed the understanding and labeling emotions component of emotion regulation. Good job.